Welcome, everybody. I'm so glad you're joining us today for this webinar. We're going to have a great webinar that will be on the intimate partner violence and homelessness study that is out of California. So this national webinar, the specific study is called the Intimate Partner Violence and Homelessness Study and Future Directions based on findings from CASPEH. So recently, the Benioff Homelessness and Housing Initiative released a report about the intersection of intimate partner violence and homelessness from the California Statewide Study of People Experiencing Homelessness, or CASPEH. During today's webinar, we will discuss some of their findings, key policy recommendations, and future directions and where we are headed in the field. We will make sure there's time at the end of the webinar for question and answers, and we will have a panel discussion. We also wanted to do a reminder that there's a lot of information and trigger related things that might come up that were part of the study in terms of violence against women and violence against people experiencing domestic and interpersonal violence, people of all genders. We want to remind you that if you are experiencing domestic violence or if there's any triggers that might come up, please take care of yourself. You can also reach out to the National Domestic Violence Hotline at 1-800-799-SAFE. And I just want to thank you all for being here and acknowledge that there's so much work that went into this. And I'm so grateful for all the brilliant people who have joined us on this call, are here today and willing to share their expertise, their lived expertise, their research expertise around the impacts of intimate partner violence and people experiencing homelessness. So I'm going to do a quick overview of our speakers today. We have so many wonderful, brilliant people with us today. Joining us is Carlo Ng. She is the Director on Gender-Based Violence Prevention and Equity in HUD's Office of the Secretary. She is a senior advisor there on policy matters involving gender-based violence to the Secretary. She was part of the director, prior to HUD, was the Director of Legal Initiatives at the National Alliance for Safe Housing. She focused on legal and policy strategies to ensure safe shelter and housing for gender-based violence survivors. She has an extensive background in advocating for survivors' housing protections, as well as providing national technical assistance and training on these issues. She also has expertise on the impact rights of survivors and immigrants in federal housing programs. She has litigated impact cases under the Fair Housing Act and related civil rights laws. Carlo is an immigrant who grew up in public housing in Boston. Next speaker we have is Anita Hargrave. She's a faculty member at BHHI and a lead author of the CASPEH report on IPV. She's an internal medicine physician and assistant professor of medicine at the University of California, San Francisco, UCSF. She practices medicine at the Safety Net Hospital in San Francisco. She's a clinician researcher who's committed to patient-oriented research aimed at providing health outcomes and equity for people who have experienced trauma and violence. Next, we have Jessica Gianola. She currently works as a housing case manager with survivors of recent wildfires, where she networks with service providers to reduce barriers to get people rehoused. She's a fellow with the BHHI Op-Ed project, where she uses her voice and her lived expertise of being unhoused to help shift the national narrative on homelessness. She grew up in unstable housing and is committed to advocating for affordable and sustainable housing and services for the increasing numbers of unhoused people across our country. Next, we have Des Martinez. Des is the executive director of We Are Not Invisible. It is a nonprofit organization that advocates for and assists individuals and families experiencing homelessness. Des became homeless for the first time at age 43 after fleeing domestic violence. Through We Are Not Invisible, Des helps those living unhoused by doing advocacy work across the country, helping people get rehoused, teaching people their rights, and making sure they have the resources and skills they need in order to thrive once rehoused. And last but not least, we also have Debbie Chang, and Debbie is the president and CEO at Blue Shield of California Foundation. The foundation is leading its work to make California the healthiest state and to end domestic violence. She oversees more than $20 million in annual grant making. Upon joining the foundation, Debbie led the organization toward increasing impact by zeroing in on prevention and addressing the root causes of domestic violence and health inequities, including economic security and housing. She's focused particularly on policy opportunities to influence Medicare and Medicaid to engage in domestic violence prevention. Through her career, she has championed equity, inclusion in health and healthcare, drawing on a deep personal commitment to building a more just and equitable world. So those are our great speakers today. It was so hard for me not to editorialize, but it's just an amazing group of presenters that I just feel in awe to get to work with and to get to learn from today's webinar. So today we will start with opening remarks, an overview of CASPEH, the research findings, policy recommendations, and we will end with closing remarks from Debbie Chang before heading into the panelists Q&A. The content shared today, just as a disclaimer, is solely the responsibility of the authors and does not represent the official views of HUD or UCFF. Sorry, I apologize. We'll now have Carlo Ng begin with some opening remarks. Take it away, Carlo. Thank you.
Thank you so much, Steve Fox. It's great to be here. Thank you so much for everyone for joining today's webinar. As Debbie mentioned, my name is Carlo Ng, and I'm the Director on Gender-Based Violence Prevention and Equity in the Secretary's Office at HUD. And as many of you folks know, intimate partner violence is a leading cause of homelessness for women and their families. I won't discuss the reasons why that is, because you'll hear from our amazing experts today about the why and also what policy solutions are really needed to resolve this major problem. The Biden-Harris administration has taken historic actions to address domestic violence and other forms of gender-based violence prevention. Last year, the White House published the country's first national plan to end gender-based violence, which included a pillar on economic security and housing stability. That pillar was co-chaired by HUD, which is my agency, and the U.S. Department of Labor, and it really emphasized the need to provide a range of flexible housing options for survivors who are facing different types of housing barriers. It also underscored the need to safeguard against housing instability and homelessness by, for example, implementing and enforcing the Violence Against Women Act's housing protections for survivors, as well as provide critical training and technical assistance to housing providers so that they understand their legal obligations to ensure that survivors have access to and do not lose their housing because of the violence that they've experienced. At HUD, we are using the national plan as our North Star. It's our North Star on what is needed to address housing instability and homelessness among survivors. And under this administration, HUD has made unprecedented investments in gender-based violence prevention. For instance, last year, in conjunction with Blue Shield, we convened HUD's first philanthropic roundtable that had 30 foundations gather and talk about issues related to gender-based violence in housing. HUD also provided trainings to hundreds of field staff across the country on gender-based violence, trauma awareness, and the Violence Against Women Act. We awarded $10 million in VAWA training and technical assistance funds, which has led to a robust multi-year training plan with HUD program offices, as well as on-call real-time training and technical assistance for many HUD housing providers, industry groups, and other stakeholders. This year, we published our first report and fact sheet on the housing and services needs of human trafficking survivors. Throughout the process of developing that report, we consulted with and compensated survivors of labor and sex trafficking from diverse backgrounds. Their feedback was extremely critical in understanding the barriers that survivors face in accessing and maintaining housing. We also continue our critical work on implementing VAWA's housing protections for survivors by drafting a proposed VAWA 2022 rule, updating VAWA forms, developing guidance, and coordinating with other federal agencies that also have VAWA housing obligations. Today, I am ecstatic to share that we have established HUD's Office on Gender-Based Violence, which was required by the 2022 reauthorization of VAWA. This office is located in the Secretary's office and will be staffed by a director, that's me right now, a senior advisor, and a policy advisor. The latter two positions are career positions, and we are currently working on posting those job descriptions very soon. Once we have permanent staff, and this is all on an expedited schedule, we look forward to creating a feedback loop with grantees and advocates like yourselves. HUD's Gender-Based Violence Office is crucial to institutionalizing the important work that we've done over the last 3 years. And all of this work has been grounded in the understanding that we have to be intentional. in centering the voices of survivors and addressing their intersecting needs and identities. And this includes survivors of color, immigrant survivors, LGBTQI survivors, and survivors with disabilities. I look forward to working with you all as we figure out real housing solutions for survivors. I'll turn it back to Debbie.
Thank you, Carlo. I think Anita, you're next. Thank you.
All right, thanks, Debbie. Thank you, Carlo, for those incredible opening remarks and sharing just a sum of the work that HUD is doing right now. Before beginning, we want to let you know that this presentation does contain the following: physical, sexual, financial, and emotional violence, discussion of abusive relationships, homelessness caused by intimate partner violence, and experiences of intimate partner violence during homelessness. It also includes quotes from people who are experiencing homelessness and IPV. Please do put your self-care first as we move through the webinar today. Throughout the webinar, I'll be using the term intimate partner violence, or IPV, which is often called domestic violence, or DV. This encompasses violence, abuse, or aggression committed by a former or current intimate partner, such as a spouse or dating partner. The California statewide study of people experiencing homelessness, or CASPEH, is the largest representative study of homelessness in the U.S. since the mid-1990s. Dr. Margot Kuchel is the principal investigator of CASPEH. It was conducted at the request of the California Health and Human Services Agency to answer critical questions about homelessness facing policymakers. And it was funded by the UCSF Benioff Homelessness and Housing Initiative, the Blue Shield of California Foundation, and the California Healthcare Foundation. Within CASPEH, the work that we'll share today aims to analyze this intersection of intimate partner violence and homelessness using both qualitative and quantitative methods. CASPEH was conducted in 8 counties representing 8 regions. It included adults over the age of 18 experiencing homelessness, and it resulted in 3,200 questionnaires paired with 365 in-depth interviews. In our qualitative analysis, we included all interviews in which participants talked about experiencing IPV, and this ultimately led to 104 included interviews. Importantly, this work involved community-engaged practices, including 3 community advisory boards. Intimate partner violence can precipitate homelessness. In this section, I'll present findings on experiences of IPV leading up to homelessness. 40% of CASPEH participants who reported IPV in the 6 months prior to homelessness indicated that violence was a reason for leaving their last housing, and 20% said it was the main reason. The median monthly income for survivors who experienced IPV prior to homelessness was only $1,000, highlighting that many people who enter homelessness following IPV have extremely limited financial resources. 1 in 5 survivors who experienced IPV prior to homelessness and reported leaving a household where they were a leaseholder had a rental subsidy. This indicates that the need to flee violence overtook our usual protections against homelessness. Jessica is going to share a quote from a survivor to illustrate the need to leave housing as a survival strategy.
I'm here now. I'm homeless because I just left the house. I just needed to leave because it was more physical and more violent.
Thank you, Jessica. I'll now pass the presentation over to my colleague, Des Martinez, who's going to talk about barriers to seeking support and safety.
Thank you, Anita. Survivors believe that relatively small amounts of financial support could have helped them avoid homelessness. Among survivors who reported IPV prior to homelessness, 73% believed that a shallow monthly subsidy would have helped them avoid homelessness for at least 2 years. 83% believed a lump sum payment would have done so, and 92% believed that a housing voucher that limited their rental contribution would have kept them housed for at least another 2 years. Survivors noted that the flexible funding strategies for food, rent, cell phone service, transportation, and childcare would have also helped them to prevent homelessness. Some participants discussed staying in abusive relationship situations to maintain housing stability for themselves and their children.
In my opinion, probably 90% of the people that are in abusive relationships would get out if they had an out to go to, if they weren't going to lose their kids, their home, their financial ability to function day to day, then it would be a whole lot easier to leave.
Survivors were concerned that discriminatory practices based on their race, ethnic background, gender, and sexual orientation limited their ability to seek safety. Several survivors of color reported lack of access to needed shelters and services due to their race or ethnic background. Male and LGBTQI+ survivors told us that they experienced social stigma against reporting violence from an intimate partner. Black survivors also expressed the hesitancy to involve law enforcement. One survivor explained that because she was a Black woman, she would think twice before calling the police about IPV, out of worry that they would hurt her or somebody else in her community.
I think twice before calling the police. I want to call, but you don't want to end up dead. It's sad to say, but it's true.
With that, I will turn it over to Jessica to tell us more about experiences during homelessness.
Thank you, Des. None of the survivors who experienced IPV prior to homelessness and reported that violence was a reason for losing their housing, 43% stated that there was a time when they wanted shelter but could not access it. 60% of survivors reported spending most of their nights unsheltered. 28% reported spending most nights in a non-domestic violence shelter. And 5% reported staying most nights in a domestic violence shelter. These findings indicate that many people leaving housing due to IPV do not go to DV shelters. In fact, many experience unsheltered homelessness. Others either enter mainstream homeless shelters, which may not have the privacy or the resources to accommodate the needs of a survivor. And when we looked further into why people were not accessing DV shelters, survivors told us that they did not have the available beds or the capacity to provide shelter. Others said that they did not know how to access DV shelters or that there were none close to where they lived. Of those who were able to enter DV shelters, many noted that the shelters lacked access to long-term affordable housing options. Due to resource limitations, several DV organizations put time limits on shelter stays, and given the lack of long-term affordable housing options, these stays could lead to returning to homelessness and increased risk of violence from their intimate partners. A survivor who was staying in a DV shelter told us,
"They make you sign something saying you're not promised housing after you leave here. We're not safe after we leave here because we're going back to the streets where our abusers are at. What happens after 60 days if I don't find housing? There's no bridges here. I'm scared."
And finally, we examined barriers to housing for survivors. 95% reported that the high cost of housing was a barrier to their exiting homelessness. Other commonly mentioned barriers include being unable to live with family or friends and a lack of help from case managers and navigators.
There should be more things for women that are abused. Somewhere to place them and house them, somewhere to give them grants, some type of funds to get them on their feet. I have nothing. I physically do not have any living relatives anymore. My friends and family are either in Nashville, Tennessee, or another country. I've never met them.
I'll now hand off the presentation to Anita to discuss our policy recommendations.
Thank you so much, Jessica. We conclude the formal presentation today with a set of evidence-driven policy recommendations based on our research. We offer recommendations that fall into 4 main categories: increase access to affordable permanent housing for survivors of IPV, increase homelessness and violence prevention, increase support for survivors currently experiencing homelessness, and center equity in all responses. There's a critical need to increase access to affordable permanent housing for survivors of IPV. This allows for swift exits from abusive situations, provides the safety and security needed to thrive and heal after experiencing violence, and decompresses domestic violence shelters so that they have the capacity to serve other survivors in moments of crisis. One mechanism for making the current housing supply more affordable is with housing subsidies. Yet currently, about 1 in 4 people who are eligible for federal rental assistance receive it. In many places throughout the US, due to the high cost of living, survivors have limited alternative housing options that would allow them to escape abusive situations while avoiding homelessness. As a result, many survivors are forced to make the decision to either stay in abusive relationships or leave and face the very real risk of homelessness. To expedite access to housing, we can embrace a housing first approach for survivors. Housing First, or DV Housing First, is an evidence-based approach that prioritizes people getting housed expeditiously and without preconditions. The aims of preventing IPV and preventing homelessness are firmly intertwined. When it comes to homelessness prevention, we need to ensure that support for survivors is flexible so that it can meet the range of needs that may fall outside what traditional rental subsidies cover. Childcare, transportation, cell phone bills, and food were among some of the highest needs that survivors voiced to us. Several continuums of care have coordinated entry points for distinct populations, such as transition age youth and families. Specialized entry points for survivors can help better meet their needs when they access the coordinated entry system. Such access points should prioritize safety and privacy of survivors, provide trauma-informed services, expedite entry, and minimize logistical barriers. A step to supporting violence prevention is survivor-driven safety planning. Ensuring that a survivor's wishes are centered, safety planning allows survivors to have control in the resolution of their situation. Increased support to help survivors develop a plan should be coupled with resources that allow them to implement that plan. Healthcare systems play a vital role in IPV prevention, as survivors may present with physical, psychological, and behavioral needs related to their experiences of violence. Healthcare settings should incorporate a wide range of trauma-informed practices and IPV prevention efforts. Finally, our participants spoke of the need to increase education efforts about IPV, including information about types of abuse or violence that may constitute intimate partner violence, and resources to support survivors. There's a critical need to increase dedicated non-congregate shelter and housing options for survivors of IPV. Survivors spoke to both the difficulties accessing DV shelters and the lack of permanent housing options that awaited them on the other side of homelessness. Additional funding is needed to increase the capacity of DV shelters. Further, DV shelters should have access to more affordable permanent housing options to ensure that survivors are exiting homelessness into housing. We also need to think of alternatives to support survivors given the reality that shelter and housing constraints, such as hotels, motels, drop-in centers. When DV shelters reach capacity, survivors still need resources to help them remain safe. The domestic violence programs and mainstream social services organizations can connect survivors to services, but many survivors reported difficulty accessing these programs. Therefore, there's a need for alternative sources of support, such as community health workers, IPV advocates, people with lived expertise, to do outreach to survivors experiencing homelessness in their communities. Systems need to increase survivor-centered safety and decrease fragmentation of families. Rather than criminalizing behaviors, responses to IPV should focus on promoting healing, resilience, and well-being for survivors and their families. Finally, and perhaps the recommendation that is the bedrock of all others, we critically need to ensure that programs and services designed for survivors center gender, sexual orientation, and cultural competency in their responses. Given the disproportionate impact of IPV on people of color and on gender and sexual minoritized communities, programs and services should be responsive to the experiences of these survivors. All right, with that, I want to thank you all for being here today. For more information, you can follow the QR codes below to our main report and to the IPV report. I'll now turn it over to Debbie Chang for our closing remarks. Thanks, Debbie.
Thank you so much, Anita. And thank you to all the speakers for giving us this rich information and data. Unfortunately, I can't get the video to start. So there we go. I want to have a special thank you to Carlo for underscoring that this issue is a priority at the federal level. The establishment of the Office of Gender-Based Violence at HUD shows the growing recognition that gender-based violence is a housing issue. And in California, we've been using the National Action Plan as a roadmap. So I encourage all of you on this call to see how that work can be adapted and implemented in your own state. Blue Shield of California Foundation co-funded this study with California Healthcare Foundation because we know that data is a powerful tool in moving policy, especially when it comes to domestic violence, a field that we know is lacking in data. I'd like to close by giving you 3 takeaways before we open it up for questions. First, we all have a role to play in ending domestic violence. It is everywhere, but it's also preventable and healable. When we fund researchers like this incredible team at UCSF and equip advocates with the data and tools they need, it helps to build evidence, to effectively make the case to policymakers, and to bring this issue to the forefront so we can end domestic violence once and for all. Second, as we've heard today, homelessness and domestic violence are linked. We can't solve one without addressing the other. And as you learned today, 40% of study participants who reported IPV in the 6 months prior to homelessness stated that violence was the main reason they left their last housing. The study highlights domestic violence housing first as a solution to increase access to affordable permanent housing for survivors and to prevent domestic violence. In 2019, the foundation funded an evaluation of housing first in California. And we learned that this survivor-driven, trauma-informed approach is incredibly effective in preventing both homelessness and domestic violence. A crucial element of the program is providing flexible funds that can be used to meet a survivor's needs, unique needs that allow them to remain housed in addition to the actual housing itself. One Housing First participant in California said that flexible funds help them buy furniture for their home, as well as diapers and clothes for their 1-year-old. Essential items that they said they had not had in years. And survivors from the CASPEH study said, as you heard, flexible funding and resources like cell phones and emergency money would have made a huge difference in their ability to leave their unsafe housing. Hearing this directly from those most impacted underscores the importance of investing in strategies that address both homelessness and domestic violence together. And that brings me to my final point. This study is better because survivors were engaged as the experts that they are. It's important in all of our work to acknowledge that survivors are both the expert at defining the problems and co-creating the solutions. All too often in the past, well-intentioned changes have not been grounded in the experience and expertise of survivors. To ensure that services and programs meet survivors' specific needs, they must have a seat at the table. In closing, when we bring in survivor expertise, we find better solutions. When we invest in research, we uncover more of the evidence policymakers need to make large-scale impact. And behind the data are real people whose lives are affected by policy and funding decisions. Now, throughout the country, I know many of you on this call are experiencing the reduction of funds from the Victims of Crime Act, which impacts our ability to support survivors. In California, thanks to the tireless efforts of advocates like you, empowered with data, The governor agreed to backfill funding through the summer of 2025. But that still leaves the future uncertain, even here. So today has been about equipping advocates like yourselves with the tools you need to advocate for change around the country. We all know how easy it is to go to a webinar, a meeting, or a conference and listen politely, and that's that. For the kinds of people and decision makers you're talking to, the difference between listening politely and taking action is having the data. So I'd ask you all to consider this question. What more can I or my organization do to weave this data and other data and research you have into the conversations you're having about changing systems and policies? If we each do this, we'll be one step closer to ending domestic violence and homelessness. And now I'm going to turn it over to Jennifer Willover from the California Partnership to End Domestic Violence for the Q&A portion. We are so fortunate in California and grateful to have CPEDV among doing just the amazing work that they do. Thank you all.
Thank you so much, Debbie, for the closing remarks, and to all of our speakers today. Like Debbie mentioned, my name is Jennifer Willover. I'm the Housing Policy Analyst with the California Partnership to End Domestic Violence. And for those who don't know, we are the state-recognized coalition for domestic violence here in California. We're so grateful to be part of this webinar today with all of our partners, sharing the valuable research that came out of the CASPEH report. At the partnership, one of our policy priorities focuses on housing and homelessness in the state of California, and we've really been able to utilize the insights to the experiences of survivors experiencing homelessness and navigating the homeless service system through our state and local advocacy efforts. We've appreciated having this recent data, which lends to the current state of experiences for survivors and allows us to provide the most up-to-date research when we're working to make informed policy changes and work with our partners across the state for changes that impact survivors who are seeking safe housing. Now, I would like to thank all of our panelists, and I'd invite them to turn on their cameras now. We have the next 20 or so minutes dedicated to our Q&A to answer as many questions as we can. I see some great ones popping up in the Q&A section already. And so I want to share that our speakers from BHHI will be joined by two other panelists, Sharon McDonald, the Senior Advisor to the Chief Policy Officer for the National Alliance to End Homelessness, and Dee Fox, NNEDV's Deputy Director for Housing Policy and Practice. So thank you all for being here. As we're going through the Q&A, I just wanted to get us started by turning to Des and Jessica to see if both of you could spend a couple minutes each speaking to the importance of having survivors involved in reshaping and implementing solutions aimed at addressing this critical intersection of IPV and homelessness.
Hi. You want to start, Jess, or you want me to start? She didn't band it up. Go ahead, Jess.
Oh, okay. Well, thank you. I think it's really important that we have voices of experience lend their knowledge of what worked and what hasn't worked for them when they've gone through this process of trying to get help when they're survivors of these horrific acts of domestic violence upon themselves and their children. And no better voice to listen to are the people who've tried to navigate the system and find what major pieces were missing, especially when they're trying to get housing. If they cannot access affordable housing, then trying to picture how to escape this reality they have currently is really, it's impossible. And it often keeps people in that situation because they see no way out. And people who are living unhoused, it's really hard to even get information to them as to what is in their area. Like, where are the shelters and how do they access them? Will they be treated with respect when they arrive? Or if they fall under any umbrella, LGBTQ, and there's any difference for themselves or their children, they need to worry then, are they going to be re-traumatized by people who are ill-trained working the facility or other guests? So what are the policies in place at these places? Are they helping or are they hindering their recovery process? So these are experiences that really someone running a program, they may not necessarily know, but someone who is living through the process, they can tell you in great detail what's worked, what hasn't worked, and what their ideas are. And we really need to give respect to their voice and their willingness to come forward and help be partnerships in this, in helping fix these broken systems that we have. So that's really what I wanted to say there. All right,
Yes, definitely echo everything you said. Why it's important to have people that have lived through this trauma is because, like Jessica said, we're the ones that went through it. Your idea of how to get me permanently housed could take 2 to 5 years, where I need stability and safety now in order to process everything that I've been through, all the trauma that I've been through. It's not just about giving somebody keys to a home and walking away. It's about being there, supportive, so we don't fall back into the same thing. To make a difference, I have different ways that I've been thinking about is like, we must reach out to the marginalized communities where they are. Programs, community centers, schools, shelters, after school programs. These are great places to start. These locations provide powerful opportunities to educate our communities and teach them how to create and implement solutions. By bringing them to the meetings where their voices can be heard, we can ensure that our communities are being heard and their needs are being addressed. We need to teach people how to speak out to policymakers at the state capitol, detailing what is necessary to prevent IPV. Educating communities, doing a call to action, empowering the voices of the survivors, and actually not just listening to them, but hearing them also. In order to uplift survivors, it's essential to listen to their stories and allow them a safe place to share it. It's crucial to have support system. And once you've survived a traumatic experience, that's where our survivors become leaders. Once you've taken the time to heal, it's important to return home and connect with other organizations to become a peer support for the next survivor in need. Teaching in schools about positive relationships, I feel, is very important. We have very young kids. If we can teach other things in school, then I believe we should be teaching kids the importance of positive relationships. And that's where they'll start to be able to identify the red flags, you know, and we'll be promoting healthy relationships in the communities and after school programs, encouraging healthy relationships among young people, done through the community centers. There's so much that is a reason why, because these are the solutions that we have, and they're good solutions, but to have us help you understand us. Each one of us dealt with the trauma differently. And your pathway to my housing is not the pathway that I needed to take, because it might have worked for somebody else. So each one of us is different. Just give us space. Don't just listen to us, hear us, and implement us in every single decision making that there is to do with IPV, DV, shelters, housing. Please involve all of us. Have somebody on your team, especially if they're saying, no, that's not going to work. That's the person you want. You don't want the person just agreeing with everything you say to be on your team. So that's the importance of having survivors on your team. And it can help cure some of these, some of these shelters for this situation, like Jess was saying, have very unknowledgeable individuals, staff working there that have never worked with people that have experienced what we experienced. And I don't want a volunteer 20-year-old saying she understands what I went through when she's only 20 and has never experienced any of it. So we got to start thinking about what people are we having as staff members that are inside of these shelters, in these programs. Are they people that experienced it? Those are the people that I want in front of me to tell me, I understand what you went through, because I know they understand what I went through, and they'll be able to address me in a different manner. So that's my thought.
Thank you both so much. And we're both we're all very grateful that you're here today to provide that really important perspective to this conversation. And we have a lot of great questions in the Q&A, so I'm going to try to go through and address a few. But I think the next one I'm going to maybe direct to Sharon and D. Fox, but of course others, you know, if you have anything you want to add, please do so. But there was a question about maybe plans or what is happening around prevention eviction for survivors who need time to address their inability to pay rent. I know that the topic of prevention services is of discussion, not only in the domestic violence field, but in the homeless service field as well. So if either of you have any comments in response to that.
Thank you, Jennifer. I'll go real quick. And thank you, Jess and Des. I really am just so deeply inspired by your work and your leadership and to be on this webinar with y'all today. You know, in terms of eviction around for survivors, we do have VAWA housing protections, and those were expanded and are a law that's in place with the VAWA 22. And so all federal housing programs are covered with VAWA 22 housing protection. So in theory, and we know in practice it's a lot different, but in theory, if you're in a federally subsidized program or you're applying for a program, you should not be discriminated against based on your survivor status. So if you are working with survivors or are a survivor who's experiencing housing discrimination as a result of domestic or sexual violence or stalking, it's very expanded. So if you have been coerced or have debt or have evictions related to domestic or sexual violence, that is a reason you should not be discriminated against in your housing. So actualizing that in practice is much more difficult. So we always encourage you to reach out to TA providers or to housing justice lawyers or legal aid entities to help you with that, because often you need a lawyer to be able to invoke your housing VAWA rights. It's there, it's on the books. The one issue that we do have is private housing is not covered by VAWA housing protections, but many states and jurisdictions do have housing laws that protect domestic and sexual violence survivors. So if that's something that you have in your area, that's good to know. There's a compendium. The National Housing Law Project has the laws for all the states and the housing protections for survivors there in private housing. So that's also very helpful. And we also are happy to work with you all. I'm part of a consortium. I should do a plug for, we have a domestic violence and sexual violence housing consortium. You can go to the Safe Housing Partnerships website, but we do work in partnership with a bunch of different TA providers on this issue. So if you are having issues, you can request technical assistance and support. And we can help connect you with housing justice lawyers that can work with you on your cases. The other thing to mention is, I'll do a plug and put it in the grant. There's a grant that's available that's out right now from HUD. There's an eviction prevention grant program that is a newish grant at HUD since 2021. It's the first of its kind that's legal services to prevent eviction. So there's a lot of great research that if you have a lawyer, you're less likely to be evicted from your home. And while this eviction grant protection program is broad-based for anybody who's potentially evicted, survivors will definitely are eligible, but we encourage people to apply, programs to apply. And I'll put that in the chat. And I was going to say one other thing in terms of VAWA housing protections, but it might come to me, but I'll pass it over to Sharon, because I'm sure you have lots of recommendations as well.
I don't. You covered the gamut. The one thing I would just say, and I think I'd like to turn it over to Kara, who wants to add some thoughts, but I think one thing that struck me in the presentation was that amongst the survivors, the people who were surveyed, amongst those who were leaseholders before coming into homelessness, 1 in 5 had a housing subsidy, which means that they should have been protected by the VAWA housing protections and weren't. And so that speaks to, I think, what could be hopefully an easy lift. Like, what can we institute before survivors lose housing subsidies? Because there's mechanisms in place, that are easy, aren't easy, that are in place that should be enforced. And I think that's really worth elevating to our partners at HUD. And Kara, did you want to add anything? Maybe she doesn't. Okay.
I can add, just to expand on that last point, Sharon. I think another really important finding that we had was that survivors' median monthly income prior to homelessness was only about $1,000 a month,
Right.
which in high cost states like California, that's
Right.
less than $600. That's $600 less than the median rent for a one bedroom. And so we
Right.
just see that survivors are dealing with not only high levels of violence that are pushing them out of their homes as a survival strategy, but they also are experiencing extreme economic precarity. They're living at the economic margins and are just trying to get by. And in states, this is not unique to California, although I will say there's more of a magnifying glass on California. The income gap, the gap between what people are able to earn and the cost of living, particularly the cost of housing, is just insurmountable. And so once people enter homelessness or take that leap to leave housing, leave an abusive situation, they're faced with extreme uncertainty, inability to access both DV shelters and mainstream homeless shelters, and an inability to bridge into long-term permanent affordable housing. And one way to address that is through rental subsidies. They also told us that lump sum payments and monthly shallow subsidies would have helped them avoid homelessness. And so really expanding on the availability of rental subsidies to low-income survivors is an important tool to increase affordability of the existing housing supply and access to permanent supportive housing. And it's really, how do we make that happen? I saw there was a question about concerns around how to also keep families intact. So keep families with their children. And I would say this is another example of that. Like if we're able to get somebody quickly into housing, and to, I think that's another question, is expanding access to DV shelters and having flexibility and ability to bring children into that space. But I see the farther up bottleneck issue here is the lack of affordable housing and that transition to long-term safety stability that is afforded by having a home, by having a house to live in.
Can I jump in? And now that everybody's chomping at the bit because we're getting into the meat of this. I think what was really striking too about the study, was that 92% of those who were surveyed said, if I had a housing subsidy, I wouldn't have become homeless. This would prevent homelessness. And then there were a number of folks who talked about, that the lack of affordable housing, the lack of not being able to financially access housing kept folks in an abusive and violent relationship, kept them trapped in the relationship that was destructive because of the lack of affordable housing. So it does create this enormous effort. So the lack of affordable housing traps people into these relationships because of fear of homelessness. It creates homelessness, and then it traps people in homelessness. I think that's all captured really well in the study and in this presentation. But then what happens is, because people are trapped in homelessness, then they are also trapped there's no way out of shelters. And so then shelters can't do the job of creating space for people who are in crisis to come in. And so we're seeing an increase in unsheltered women and sheltered people nationally. So really, I'm really, really grateful for this attention to housing and the importance of housing subsidies. And I wish I could say that the news is getting better, but as members of Congress are looking at closing out the budget for the year, there's no big new boatload of housing subsidies coming down the pike. And so I think there's a great need for collaboration to kind of create the resources that we need to do a good job for all people experiencing homelessness. Sorry. Oh, wait, can I say one other thing? A shelter that receives federal HUD dollars, a dime of federal HUD dollars, cannot tell you that your children can't be housed with you. You know, they are not allowed to say this 13-year-old boy cannot be in shelter with you. It's been not allowed for a lot of years. It still happens. It's not allowed. No, call, make noise. That's
Thank you all so much. There's a couple questions in the chat, multiple kind of having the same theme. So I wanted to open up about how those particularly folks working for programs that aren't DV specific programs, how they support when they get referrals or calls from survivors who are actively experience IPV, maybe not ready to leave and go to the program, or just in general, how they can better support survivors when they receive those calls. And so I'm going to open up, I think, Jessica and anyone else who wants to weigh in.
Thank you, Jennifer. And thank you, Emily, for the question I saw there on really what to do when someone's not ready to leave. And this is something that I've come in contact with clients who have left previous domestic violence partners, and maybe the person's still somewhere in their life, or they're contemplating leaving them, as well as loved ones. And what I would really want to encourage folks to do, if you have anyone in your life that is in this scenario, is just be that safe person for that person who's in that situation, knowing that they can come to you and that you might not be just like sharing their business across the board, like on social media, or breaking their confidence. It's really important. They need someone safe to talk to. Because a lot of times they may be venting, they may be sharing serious scenarios that are happening, but they're just not quite ready to leave yet. And there's many factors. It could be they have children together and they're concerned about breaking up the family, thinking that it might be better to keep a family together versus apart in a healthy relationship apart. But it takes some time to get there. Encourage them to seek counseling if they can, or really multiplying the number of safe people that they can have in their contact list, making a plan with them, identifying keywords. I do this with a loved one that's in a situation of, okay, if you text me this number or this word, I know that something serious, I will be there. And you're just able to get that plan to get them self-sufficient. A lot of the times people stay in this situation because they don't know how to make it on their own. And so helping them sign up for anything that is going to be income-based, something they can, a housing situation that they can afford on their own with their kids, knowing that they can get cash aid help, and how that process works. Not everybody knows that. So just really being that resource that's working the background with them, of helping lay those steps so that when they are ready, they can take those steps and get to safety and independence. Those are just, let's see if I had anything else I would put down, because that happens pretty frequently. Unfortunately, people can't leave until they're ready. It took me 8 years myself. And I had a friend that I would always just like offload to. And finally one day she just said, I don't know what else to tell you. Like, I've told you everything. And for me, I was like, okay, she has told me everything. Now it's up to me. I had to make that decision to do it. So, but having someone important to talk to and this trustworthy is really critical. I think that was it on that one, but yes, thank you for the question.
Yeah, I wanted to jump in on this question regarding, my experience probably was different. So I was ready. Unfortunately, my county had absolutely no resources available for me. I didn't qualify. I was told that because I had left, I am now homeless, and I didn't qualify for any of the homeless beds because the definitions were I had to be homeless for a year in order to be considered chronically homeless. So I was turned away from the DV shelter in my county because I didn't qualify as homeless. I had left on my own. They told me I had a vehicle to sleep in, and because the funds they were receiving, they weren't allowed to offer me a bed. I was ready. I was ready. I know I deserve better. I was tired. I was exhausted mentally, but I was ready. Unfortunately, there was no bed. There was no help. there was no resources. It was always, we don't have funds. We don't have funds. Wait till January when the funds come in. Well, I'm sorry. Kind of tired of getting my ass beat. Kind of tired of being called all kinds of names every day. I'm losing hope. I didn't believe in anybody anymore spiritually. So I went back, endured it again, got to the point where I didn't want to live, but I wanted to live. So I chose the street. Not everybody out there that you see in a tent is wanting to be there, but some of us are fleeing domestic violence from home. And because our county and city doesn't have the resources, or they misspent the funds that were given to them, then a lot of us are left out there. If the services and resources would have been available that day that I was fleeing, let's help her, let's help get her out of there. Then I would have been helped a lot sooner. But having to go back is not always a choice. It wasn't, I didn't have kids with the person or anything. It was just, I didn't want to be out there. I was scared. But after going back and enduring it more and wanting to not live anymore in this world, it made me think that I deserve to live. I've been through it. I'll be damned if I'm going to go out this way. And so I chose the street. I chose the street, and then finally got upset, got mad, got tired of the abuse I got on the streets was worse than at home. And these are by strangers. At home, at least I knew it was only one person. I knew the person that was abusing me. On the streets, you don't know who they are. They're just anybody and everybody. Daily this happens. And so I think it's a lot of different stories. Listen to us. I don't care if it's 8 or 9 times we come and knock on your door and ask for help. Let us in. Every single time. It doesn't matter. Some people, it gets to the point to where it takes them time, to get to that point, to have enough faith, to have enough, belief in themselves that they can make it without this person. Because mind you, we're brainwashed into thinking we can't make it without this person. There's a reason why we're at-home moms. There's a reason why we don't have jobs, no cars in our name. These are the red flags that we need to start teaching our youth today, so they don't get in those situations where they're left. If I would have been told all this stuff from the past, I probably would have had everything in my name too. I would have had stability. My name would have been on the lease. There would have been stuff, but take them. Every single time they knock on your door and they need help, no matter how many times they went back, you open up that door and you let them in. Because there's going to be that one time that they're going to just stay and they're going to excel and they're going to get the services they need. But also with the shelter that I ended up going to, I didn't like the counselors in there because they just said that they were at the university and they had to get hours and hurry up and do this. And I was just a number. So, I didn't take any of the counselors that were at the DV shelter when I finally ended up getting in, because of the way the students were talking to me. These are younger kids than I am. They were young enough to be my child. And for them to sit there and say, well, I just need to hurry up and get my units. Why should I tell you the trauma that I've endured? The most disgusting things that I've been through in my life, I'm supposed to share them with you. And next week I have a different counselor, and the next week after that. So we need to think about the resources that we are given to individuals with trauma. If you want us to heal, give me somebody who's actually been through what I've been through. Peer support. That's why lived experience individuals are very important, because turn them into peer supporters, get them in them seats, because I would rather have somebody sitting across from me understanding what I went through and meaning it when they say it. Sorry, I can go on and on.
No apologies, Des. Thank you so much for sharing that and for sharing parts of your experience. I think, everything that you just expressed really lends to the critical need that we've talked about and people are asking for, having trauma-informed care, trainings within the field and with others who intersect with survivors. I think a key takeaway for others who have asked those questions of how they can support is exactly what you said, and that survivors will come back many times, and that should not be a reflection or judgment on them at all, and to just continue to be open arms and be there for them. So thank you so much for sharing that. I don't know if others had any final comments, but it is 1 o'clock, so I think we're going to wrap up. I just want to express my very deep gratitude to all of our speakers, and our panelists today for sharing your experiences and answering these questions. I appreciate all of the attendees who have been here today. You all seemed very interested in the research that was presented, so I appreciate all of your questions and being here today. For those who registered, we'll be sending out the PowerPoint and the slides, and I hope everyone has a great day.
Are you ready to close the webinar? Looks like it.